Today, I'll be talking about CJD. This is Dr. Baker. I'm a board-certified neurosurgeon. CJD stands for Creutzfeldt-Jakob disease. CJD is rare. It's a degenerative condition of the brain that is one of the most devastating and fatal conditions of the brain. It's classified as a prion disease. It's caused by misfolded proteins that lead to brain damage. These prions are actually infectious agents composed of proteins. CJD can occur sporadically, can be inherited, or acquired by exposure to infected tissue. How does it present? With something called rapidly progressive dementia, myoclonus, sudden muscle spasm, visual disturbance, loss of coordination, something called ataxia. You can also see behavioral changes. Some people have memory loss with it. In advanced stages, patients have severe mental deterioration and they become comatose. How does it get worked up? First, you have to do a full neurologic examination, get a history, and ask specifically about the progression of this condition. And there's a study done called electroencephalogram, EEG. It shows a specific characteristic called periodic sharp wave complexes, which can help with the diagnosis. And when you get an MRI, it shows hyperintensities in a specific part of the brain called caudate nucleus putamen, abnormalities in DWI sequence. When you do a CSF analysis on these patients, there is a 14-3-3 protein. That's what you look for to help with the diagnosis. And there's also something called real-time waking-induced conversion protein assay, which can help. It's more specific for this. You can also do brain biopsy. It's really complicated. If you do a brain biopsy with this condition, you have to dump all the surgical instrument that they use because it increases the risk of this condition being spread to another patient who undergoes brain surgery with the same instrument because it's very infectious. What can you do about it? Essentially, there is no cure for this. And when you try to manage this condition, you have to be supportive. Palliative care needs to be involved. And you just need to control the patient's symptoms, keep them comfortable as best as you can, because ultimately this is a fatal disease and these patients end up dying. If you have any questions about this condition or any of the contents that I've put, please do not hesitate to reach out.